Hello and welcome to this quick demo of Business Analyst for the health industry. Business Analyst is one of the most powerful tools we have for supporting hospitals and health-related services organizations. Basically, Business Analyst is the combination of a vast amount of socioeconomic and behavioral variables with the geoanalytical power of ArcGIS. So let me show you some of the great capabilities you will have access using BA. In this scenario, we are trying to help a home health service organization to expand their locations strategically. They need to target those sectors within their community where competitors are capturing their potential clients. So, for this case, it will be meaningful to understand the distribution of older adults that are Medicare beneficiaries. So let's go access the different databases that we have in Business Analyst. Let's go to Create, Color Code Maps, and select Browse All Variables. You can see that we have access to many datasets. We have information related to population, income, age, health-related information, and even consumer spending and behavioral data. I will access to the age-related dataset, and here I can even create my own target. I can use the 2010 Census Bureau information, or I can use the 2019 or 2024 projections created by Esri. For this case, I will use the 2019 data. Then I can specify my age range. So I just need to specify that range, and then I can select the gender. In this case, both. Let's go to save this variable, and in less than 1 minute, we will have this information map. Seeing this map, we can understand the distribution of older adults across this region. The darker the census tract, the higher the number of people within this segmentation. I can see this information as a raw number or as a percentage in terms of the total population. Also, I can add another variable. In this case, I will look for Medicare data, select the variable Have Medicare, and then the software will combine these two variables and show me a different kind of symbology. Here, the darker the circle, the higher the number of people in this segmentation, over 60 years old. The bigger the circle, the higher the number of families that have Medicare. So you can see clearly that there are 5 pockets of target population across this region. 2 of these pockets are already covered by my offices, but there are 3 empty or gaps that I can cover with new offices. There is a pocket here in Arlington, there is another one in Colleyville, and the last one would be in Duncanville. Here's when the power of business analysts come to action. First, I would like to create a map that just highlight these potential areas. But also, I want to add another variable to evaluate if I already have patients in those areas. So to do that, I will do a smart search. So let's go ahead and look for our variables. In this case, our custom variable. There we go. Then also we have the Medicare variable. Perfect. But also I can access to my own data. And here I have my information coming from my internal systems that have the number of patients per census block. So I will select this new variable and apply. After a couple of minutes, I will have a map that shows these three variables together. So here's where I can filter my information. For example, I want to see only those census blocks where at least I have more than 20% of people over 60 years old. The same with Medicare, over 20% of families that have Medicare. And at least I want to have 1 to 20 patients for each of these census blocks. So now I can handle these locations to my market development team or real estate team so they can start looking for potential locations where we can open a new one. But now, for the sake of this demo, say that my research team came up with 3 new potential locations. And now it's my work to evaluate which one of those is the most suitable for extending our network. So for that, I can use the new suitability analysis. With the suitability analysis, I can compare the 3 new locations that you can see here in the map in orange to define which one of those is the best option to start with my network extension. So I will select these 3 locations and I will create an area of influence of 10 minutes dry time around each of these points. I'll select the suitability analysis here, and now I can start with my analysis. Now, for this analysis, I will use the same variables. However, I want to add a new one, the number of competitors that each of these locations have. For that, I can go ahead to create maps, select business and facility search, and here I can do a search using the NAICS code directory. NAICS stands for the North American Industry Classification System. If I go ahead to healthcare and social assistance, and then I look for home healthcare services, I can copy this code in Business Analyst. Let me go ahead here, paste the code here in the search, and basically search for all the home health services organizations across the region. I can even filter this information by the number of employees. And then I can aggregate this data in order to get a new variable for my analysis. So let me go back to my suitability analysis. There we go. And I will start adding my variables. So here, again, let me go ahead very quickly, select my classical variables. And here in my own data, I will select the number of patients and the number of competitors that I got from my business search. I just need to apply this. Let me turn off this layer. There we go. And you can see how the software is using each of these variables and is mixing them to create an index. In this case, each of the variables have the same weight. I can change the weighting of each of these variables. For example, in the case of older adults, I can modify this to 35%. And then lock this variable in order to keep this weighting. Also, we think that a more suitable site will be one with fewer competitors. So we are making this relationship inverse. And then let's assign here 30% and lock the variable. Finally, families with Medicare under Medicare will have 20%. You can see how each of these areas have been modified. The index is recalculated, and now it is Colibille, the one that have the higher score. Finally, once we have a result, we can act. We not only can decide what is the best place to open a new office, but also we can have a deeper understanding of the population characteristics in this service area. In order to do that, what I will do is create an infographic. So let's select the option infographic, and quickly you can see that you have access now to a profile that shows you key facts of this community. You can see, for example, information related to their annual spending, education, lifestyle habits, and so on. I will select the marketing profile infographics because this one have a particular element called tapestry segmentation. This is a system that identified 68 distinctive markets in the US based on socioeconomic and demographic characteristics. It will provide you an accurate, comprehensive profile of your customers. So here, for example, I can select to see the report, and you can see very valuable information here. For example, most of these people are physically fit, residents actively pursue a number of sports, and so on. So you can start understanding your community in order to better target your services for them. This was a quick demo of what you can do in Business Analyst, and I hope that you enjoy it. And if you have any questions, please reach out to the Health and Human Services team. Thank you.